meka but then na I'm sure meka kakra na me adoma Wednesday adwenkyere one am de be me topic nti na me be man style bia bi na fie da bugu be so Friday masan bu agu ne so anopa e be din komo don't forget say if it the first day of October ekose October boso me ba na wie no e boso me I create awareness ema breast cancer eno and ama ye benya the Men in Arms Association and I say Men in Arms Against Breast Cancer mia your group no we are helping to fight against breast cancer anopa ye ba be din komo efa dwumadi shonko bi the national women and I say young women ministry emako no the national women ministry e di dwumadi shonko bi baso na ye be di ho nkomo anopa we are privileged to have Dr. Mrs. Ruth Asamani, or medical doctor with the surgical department or Asante Bekwai, all the way from Asante region, Asante Bekwai, no Abeka home. I be din komo afa a good women ministry, Omujuma de Aomode banner. Doc, anopa me watching. Uchi no nshada nya de kakra ho no. Me nso afa na me so me suan brofo ende. E ba yire say don't worry. Obetimi a blend the English with the tree, but the tree should be more. Obi o asante be kwai. E na won nshada nya de otwi. Hey, I critical. Yemo akwaba. In the first place, you have to say good women ministry. Mosumi a month for creating awareness on breast cancer. Jumadi be na mo de babontin.
Okay, see, near say this year, no, yeah, say, yeah, Takradi, yeah, host to Takradi, yeah, the talk and also screening, the best screening, young targets about 500 women in Takradi. So we create the awareness by giving the talk and also do the screening for them.
Okay, so among all the problems Emma facing. Among all the diseases I will be say, why did you choose breast cancer?
Okay, thank you. So we've realized that in Africa, the main cause of death due to cancer, Africa blacks, we are winning, and that's how come they created this month, so that we keep on helping. Giving the talk, helping with the screen to catch them young and help prevent the death, the mortality that is going on.
Okay, so that is why you chose breast cancer.
Breast cancer.
Okay, and you know, and near my brain side, and because most is screening. So screening, no. Why must I get screened?
Yeah, it's when we screen you. Let me say, breast cancer doesn't come in a day, not just a week or month. When we screen you and we are able to pick a mass or a lump in your breast, any cancer, we'll just take it out for you. Now, it is said that if you are aware, you will prevent it. If you are a buama and into the cancer that will kill you. So screening is the best. Screening is a form of prevention. You will get it.
I get it.
So I like the screening than getting to the stage of having it and treating it, because that is when complication can set in.
So as you rightly said, say, you like the screening more than say a bit true. Is it going to be something that mobile periodically and as mobile training you do October every year and sana because I stand to be corrected. We are in the 10th month of the year. Until they say, Mama say a problem. Why do you have to wait from January till October and sana? Masha say to sana.
Most of the churches, especially, I was with Committee for CAC before getting married to my husband, who is also a pastor at Top Base, and I moved there. So with Christ
Top Base,
Top Base, yeah.
Oh, okay.
With my church, I remember we do the screening. We've done the screening, I think, the last 2 years in Meko, the women ministry. I was by then the secretary for the Good Women Ministry over there.
Oh, local.
Yeah, local. So it's not that we wait for the year or we wait for a long time. We do the periodic screening, and most of the times when you go to the hospital, it's part of the advice that any time from 20 to 30 years, if you are 20 to 30, we expect you to do the screening at least once or twice in a year, or every 2 years, every 2 years. But when you are above 40 years, we expect you to do it yearly. And you bear with me, the earlier we catch up something, that is when we aggressively handle you. So the screening is very good. We have to do it periodically.
Okay. We Christians and we believe in God, and in Ephesians 6:12 says, any other spirit. There are people who think breast cancer, and I see and now say, sorry to say, I say, is that a myth or a reality?
I would say it's a myth, and I'll also say it's a reality to some societies or people, others believe. You believe, you can agree with me that when you believe in something, so I always advise people when we chance on a tumor or a mass in the breast, I say, you are a Christian like me. Let's tackle the medical one, and we back up with prayers. That one, it will even facilitate the healing. And others also believe that this one, I'll pray, it will go. They can pray and it will go. That is their societal belief. So I always encourage both, but I stand in for do the screening. Let's get the problem. We tackle it with the medical aspect, whilst we also embark it with the spiritual aspect by praying. And it works.
So let me take you back to Takoradi. You said Takoradi and I'm way. Why Takoradi?
This year we chose Takoradi. I think last year it was Temali. Last 2 years it was Kumasi. So we are going. We are using. We are rotating. So I was informed that we'll use Takoradi this year.
So Takoradi and I'm more useful. Then you are serving the people of Takoradi. It's being organized by national. And Accra, and I wouldn't travel from Accra. Those in Cape Coast wouldn't travel from Cape Coast. Those in Kumasi wouldn't travel from Kumasi. Omunina Takoradi for the screening. If I understand you, yes, I'm so be or you're part of the Good Men Ministry. Travel from far and near. Obia Takoradi. No,
Obia Takoradi. Most of the churches, we've done most of the screenings in the regions. You see how we intentionally push it to the last Sunday of October. That we'll do it 29th of October. So that is when, by then, almost most of the churches have done their screening, they pick up conditions and they are managing. So we'll go and do the mop-up and even pick, we are not even working with only the churches. We are using the community. That's why we've given such a target.
I see.
So with the other regions, we are doing the screening in the churches and other places. So nobody is to travel to Takoradi.
It's a good initiative by the Good Men Ministry. Probably Ubuoha, she being a member of the Good Men Ministry, being a member of the church, today happens to be the first time. Be a what breast cancer, but we name what the breast cancer is. Let us use some few minutes to educate our members and the general public. You can say breast cancer, it be a yate. Obinso, the first time I ought the name breast cancer, and you can breast cancer, a dandy.
Okay, that's it. You can breast cancer, a nufu kukri. Cancer, kukram, cancer in the breast. Nayaka cancer, yes, just abnormal growth of tissue. So breast no so tissue is ena or honambi or it is a kukram betoma, not to say tissue no they are going haywire without any control. And the normal circumstance in the system, no, we call there's a stage of apoptosis, like cell be grow, then a stage will come. Now we like what die off for another cycle to continue. But when cancer is setting, there is no control.
Okay.
There is no control. And it is said that it's the second most gynecological cause of cancer that kill blacks in Africa.
Okay.
And yes, breast is more common in women than men. I'll tell you the reason why.
A man be to breast cancer.
Oh yeah. A man even in more and to breast cancer. Because there's a gene that control mutation. And Ubia was a gene. And it's a gene who touch him. I touch him our boy more betimena. I touch him our bemme more betimena. I touch him our bamuswa or betimia a day. And yes, a cause, the cause near any breast cancer. We don't know up to now. The cause has not been given out. But they said there are some risk factors. Risk factors, no. Ebini gender. As you rightly say, a ma inya more than a man. A man be a bear 1 in a million. Yeah, ufa 150 men or bakubitinia. Okay. Bakubitinia breast cancer. And unlike women, over Mabes Tena, that's how we say gender. Females are at more risk. A been age. Now, age and also a risk factor. The more who advance in age, you are at risk. Research be stress as early menarche. Menarche means me find say would be the age of menarche is first time or menstruating. First time or buy bunisa. And no say yes say obi bunisa as earlier as less than 12 years. There is a hormone called estrogen. Okay. Say nipani bunisa at the age of 10 years. Now obe get it to the menopause at the age of 50 years. You know, say most of the time, no, exposure to the estrogen every month. Okay. Every month you'll be exposed to estrogen. That is when you menstruate. Yeah. And the estrogen too has effects on the breast cancer development. So the more you are exposed to it. Do you get where I'm coming from? I understand it. Yeah. So then genetic risks. There's a gene called BRCA gene. Okay. And that BRCA gene is a gene in every human and animal which produce a protein that protects our DNA. So our gene, your DNA is a gene that control our genetic makeup. Now, our gene, BRCA gene, a protein, it protects our DNA. DNA is a very vital gene for us. Now, our BRCA gene who touching ma. Not just say mutation, say gene sequence. No, it was say bibi shaha. Na BRCA gene na intimian correct sequencing. Na mutation be more. It may affect it. Of course, it makes the person high risk of getting the breast cancer. Okay. And now, with all these things that you are talking about, you said there so be started be a menstruation from age 12. Yeah. You being a medical expert, at what age, for the early stage, being with breast cancer? The moment I started menstruating, you are at risk of getting breast cancer. Not that. It is said that breast cancer mostly occur in the advanced age, like 50 years, 55 going. But with the estrogen, like the hormone exposure, is early menarche. When someone gets into menopause or menstruating, into that estrogen hormone, you'll be exposed to every month. It goes to rest. Sure. Do you get it?
Yeah.
So if let's take it at age 15, a lady gets her menarche, and someone also gets it at age 12. By the time, and we are all, let's say we are all, the two of them will end their menopause at age 50. You bear with me that the one who is 12 will be exposed to estrogen for more than 3 years before the person, additional 3 years. So that also, it's one of the risks with the hormonal exposure. That is when we always even advise, when women are getting into their menopause, they'll have, when they are even in their menopause, they have this menopausal symptoms. Then they'll be forced to, for the doctors to put them on hormones that will reduce those flashes and make them young and not experience those things. When you do that, you are also exposing yourself to the hormonal exposure, which will also predispose you to that state.
Okay.
And we even say some modifiable things be what mean my breast cancer. Obu radiations. Ebu all the time or person try X-ray. And I'm calling doctor now mama try X-ray. X-ray it release a lot of radiations to our system. And so we always say don't rush to take X-ray when your doctor hasn't given you the request. Do we get it? And at times smoking. People who smoke and excess alcohol intake, all those things are also risks. They cause that risk factors.
So some of the risk factors in that you have to on the screen now. Okay, so you made mention of examination, one more examine a breast, to detect whether there is a lump in the breast that it developed, open up. Assuming someone is not close to any hospital, assuming someone is not close to any medical center, can you be examined by yourself? And how do you examine the breast by yourself to detect, say, there's a lump in your breast?
Okay, good. So every woman can examine herself, and even the man can examine himself, and the man can even examine the woman.
Okay.
Do we get it? It's very simple. It doesn't need any special education. Your main target, I'm looking for an abnormal mass I've not felt in my breast before. So I always advise, when you finish menstruating, you give yourself about 5 to 7 days. You are done with your menses. Because when you are menstruating, there's a lot of hormone in your system. Your breast become heavy, so you feel there's a problem. Meanwhile, it's just hormonal something that is going on. So after that, you can stand in front of your mirror, and you must be naked, right?
Okay.
Then you put, if you want to do the left breast first, you just put your left hand on your head. Then in your mind, just divide the breast into 4.
Okay.
So 1 quadrant, 2nd, 3rd, 4th. Then the 4 division, your hand, you don't dig it as a whole. You use, you get what I mean? Then you press. Now, the 4 way, press it. Press hard to feel if there is a mass. You go quadrant by quadrant. The quadrant that you divided your.
So probably if the word quadrant and esoma will be a send you watch chimu and 9 in the section be a.
In the section be now do sa like who feel do say 5 so be who be a enye ababiana. Abani be a very slippery, and you know we call it a breast mouse. And we are fibroadenoma, and you're cancerous. And we are very slippery. It's very difficult for you to chance on it. They are showing us. That is how it is. And when you even finish the quadrants, you can go into your axilla. Because you say your lymph nodes also be kuro bi wo ne ho a say me van say kuro to nan a so ya akwala obekaya now to see the bibi adua o
adua bi abehye
and they are lift or they drain fluid to the heart and he say no for no problem wo ho na eye conscious and bibi sa obetimi a press ubenya o say friend the adua into be examine wa motive so uwie no na wa ba the other side into eba ni say uhu bibi now you feel comfortable don't get scared and no one say go to the public any hospital so person me hwe me nufu once a nurses for no be fifia hwe so man bibi eni so you okay so one unya certain with your age e beti your free bibi mammogram is for the advanced age scan will be for the 25 30 35 and on your breast scan say bibi woman you be pick amount now why you certain why clear into breast examination dey obi bia timi obi bia timi
so it's something that any kind of say ebia at that time of the month and after menstruation until every month you need to be examining the breast to detect into beboa ama say bibi abama na say foreign material bi abamu a obetimi a detecting and term okay well very soon maybe but the most important thing about the good men ministry and the women in our church not the good men and young ladies and youth for so a word of advice to our young ladies when it comes to the breast examination say me omontena fie en ka say afin mu nyina ideally say ne wo kan say obu ho na wontimi nya at least nipa ne timi call hospital they say 3 or 4 times in a year na cramp for breast examination. I don't think so Bianca
bad. And health workers we are happy. You say we are health cautious. And say ma won po to and more wo boa more. It's just contact a nurse or go to the hospital. One your wo be ya ma. It's a foot na we kakra medema young ladies they say breast exams no enye adibia ehia sukuko antina waye wakasa otimi ye no every month bia obetimi aye u feel say u feel be different woman na waye den na wetu anamo na waba oba se eye bibi na wo mu aye behu na ya boa se enye bibi anso a ye be ka chiro ena young ones no so you take advantage to do it for our parents. Yeah, mama no woman na wo dey practice why your nurse wo fie na wo miamia ne nufu no bibi woman na waka mama ye nkwa na nkwohwe na asem feel say bibi say oba na ye bibi a enye cancer you even be happy yourself why ye buki na ayama enye serious surgery bia ye be ya ma no why den why free nti me ma ye ntwen wo fie na eko ye cancer na cancer no don say symptoms is so weird obo say na nipa me nufu fi moja ne nufu na no ne po no fi moja ye so obo say ne nufu na say wo ho ekutu pojuran don say ekutu ne hunu no
start to say
na wo so nufu ne mua ye kese ye red one ye careful create ni ye kuro na sa kuro no so he enhili ebeba ne say je ye den ye twa onufu no obu ho a wenya breast cancer ena ama wa bottle that is not the end of your life. Go for your chemo or your treatments and keep on praying. So prayers with the treatments, you'll be healed
faster. Sure. All right, thank you very much. So when inu mema na momo yemwa inu yama no yema me no ene yire no mo se na ebe ya yebetumi etu eye kokoram a beto emma no for many inu yama no so no eno for mo. We are still in the month of October and we are fighting against breast cancer. So men in arms against breast cancer, let us come together and fight and help our sisters, our wives, and fight against breast cancer. And I Dr. Anase, Dr. Mrs. Ruth Asamani, or a medical doctor at the surgical department, Asante Bekwai, a whole and a young mammy, Asamani, Nyasumani, Asamani, Dr. Mrs. Ruth Asamani, right? That is the name for it in Asamani. doc yebeda ase na me share say obe my mu chechemu. So don't forget also juma the date be na eba so
29th of October Takoradi.
29th October and eba so Takoradi. Anopa
no, 1 o'clock after
PM.
church service.
Okay.
Yeah, and it's in all the circuits.
Water
the members around to obey sorry. Now I take advantage. No, about it's by 1 o'clock.
All right. Yeah, that's it. I mean, sure. Until ha, and a be my kwama me was juma di no train yet and kunya so yetimi nyina aba na wie na. So danke say call e dia ma wa wotifi na Makasi TV and number 1 on your screen. So and the technical guys nyina no onyankopon insha mo executive producer Elder Dominic Boache and Senior Sally na nekua boajo abeka ma. Don't forget me